Yeah, my name is Hoyen. I'm consultant psychiatrist, professor of psychiatry, and editor of Global Psychiatry Archives. That's the name of the journal we now gave it. We sometimes talk about papers we have been publishing, and this is quite an unusual paper because it's a protocol for the process evaluation of a new trial, which has been called the Impulse study. I come to this abbreviation. It's quite good team, an interesting team from London, the Unit for Social and Community Psychiatry, and some countries in Eastern Europe, Southeastern Europe, Montenegro, Kosovo, Bosnia and Herzegovina, Macedonia, Serbia, and even someone from Australia supporting this. Right, so the idea behind this is that there's a specific intervention called DIALOG, which is trying to use an app, a computer app, and a laptop, and a handheld computer, and tries to develop a specific intervention for people with psychotic disorders. And the idea now is to check this dialogue intervention in a large sample, and this sample is then in the southeast. It's about 81 clinicians working on this and 450 or 460 patients. So these people have then dialogue sessions, so that's computer-based intervention over 12 months for 6 times each. And then there will be other type of interventions as well, which is treatment as usual. But this is an extra intervention, and it's the idea of this study is to assess this intervention. The study is called Impulse, Intervention for Patients with Psychotic Disorder in Low and Middle Income Countries in Southeast Europe. And so the protocol is the evaluation of the whole intervention, so more or less to assess the dialogue intervention, this computer-based intervention for patients, where they focus on specific problems they have. They score them first, then discuss them, try to find solutions. So this is a very specific intervention for small groups of patients. And the question is, does the intervention work? And is it acceptable? And is the intervention fidelity there? So people do what they expected to do. And then eventually, is this cost effective? Does it provide the clinical outcome? And is it doable? So that's a context which might influence the variation in acceptability. So the question, and then there's a very comprehensive process evaluation for this trial. And so it's about the funding. So there's lots of input, funding, support from local services, researcher input. Then there's specific activities, training of doctors, focusing on individual stakeholders, analysis of this study, pilot study, translation, providing and getting purchased tablet computers, set up of the training. So then the output is, how is it implemented? How is the training modified? How is the setting modified? Then the question, there's a plan. So then there's specific outcomes. Does the intervention work? Is the process implemented properly? Have there been the modifications, and what's the cost of all this? And then the question finally is the intervention valid and doable? And there are plenty of sources, data sources, which will be interventions and interviews with patients, stakeholders, looking what the clinicians say, patient note, patients' booklets, and researchers' notes. So comprehensive is intervention of the assessment, and the final is then that this should or will lead to some type of checking of the intervention acceptability. So what's the clinician's perspective concerning the intervention? what's the patient's perception, how much burden, how difficult it is. Do people accept the intervention sufficiently to accept it and do it? And if the patient and the doctors, clinicians accept it, then the intervention has a chance to work. So it's not only whether it works, but also the process of how it works and how the parameters which are responsible for an outcome or a decent outcome, how do they interact and how do they work? So this is a very good example of how a study should be done, and this team can be supported by the fact that the whole of the process and the whole of the assessment and the study plan has been assessed and published even before the study has been finished or even started in some areas. I think this is the future, where people have to publish a protocol before the study to make sure that what they want to do is what they eventually do, instead of just doing something and finding or picking for outcomes after a study has been done. So I hope you are interested. If you want to read the full paper, please check on our website, www.globalpsychiatry.co.uk. Or if you have more interest in learning quickly about such studies which we published, please check or subscribe to our YouTube channel. Thanks for your interest, and thanks for listening to